physician who for the last 20 years has worked in a public hospital for the uninsured.
I've been a practicing family physician and still practice for over 30 years.
Also a cardiovascular surgeon with over 20 years clinical experience taking care of patients.
Practicing OBGYN specialist from Johnson City, Tennessee.
I'm a physician. I practiced obstetrics and gynecology for 25 years back home in Texas.
OBGYN physician for 26 years before Congress.
And before coming to Congress, I was a practicing physician, took care of patients for over 20 years.
Paul Brown, I'm a family doctor from Georgia, represent the 10th Congressional District here in Congress.
In this whole debate about health care, it's important to think about the principles that we ought to adhere to. And the principles of accessibility and affordability and quality and responsiveness and innovation and choices in the system all are improved by a better plan than has been presented by the Speaker and the Democrats in charge.
This is an incredibly important time in our country to work on health care. All sides of the aisle, both ends of the Capitol agree there's much work that needs to be done. But it's important we do the right thing at the right time.
What is at stake is the ability of you, the patient, to access the sort of quality health care that is important to you.
If we're going to get health care right, which I believe most Americans want to be sure that we do it right, there are a couple things we need to do. First of all, we need to preserve the sanctity of the doctor-patient relationship because it's built on trust between a doctor and a patient.
It's very important to have the trust of your physician in order to make the right decisions for your health care. I'm very concerned that the Democrat version of this health care reform bill could be very damaging to that sacred relationship.
Medical decisions should be made between the family, a patient, and their doctor. And the government should not be injected in between, and bureaucrats in Washington should not be making those health care decisions.
What we don't want to do is get ourselves in a situation where the doctor doesn't get to decide, but he looks at a chart, based on what's available that he can do. And those things being made available by a bureaucrat in Washington.
We have to get the cost of health insurance down, and the only way to do that is to create competition, and real transparency in the insurance marketplace. The way you do that is you allow small businesses and individuals to pool together in various ways to actually increase their purchasing power.
If you have a pre-existing condition, which many of my patients have had, and I have family members that have pre-existing conditions, we are able to provide that coverage and have a plan to provide that coverage without the government controlling those decisions.
We have to make it so health care costs are competitive. And actually, Congress and states have stood in the way of that, to allow people to purchase their health care around the country and not be limited by state lines, to allow people to join in groups so they can have the added purchasing power of purchasing groups, to make sure people have the choice of purchasing a plan that fits for them.
Let's work together and get a good bipartisan solution in place that's going to really address the health care needs of American families.
So I highly encourage everyone to say no to H.R. 3200, no to Obamacare. It's absolutely critical that our plan is heard and that you demand it, because it's going to be the American people that's going to make a change in the direction that we're headed.
And the more you peel the onion back, the more intrusion into our personal lives that you see this bill doing.
People need care that's affordable and portable, particularly true in an economy that's on the downturn. People are losing jobs, and their big concern is, well, if I lose my job and I lose my insurance, where will I get coverage? We could help make that coverage available. We could help, again, with insurance reform. Some people might need some additional help with tax credits. All of those things are within our purview. They're available to us to do today. They don't break the piggy bank in order to do them, and they provide more coverage for more Americans, again, without turning over an additional segment of the American economy to the federal government, because goodness knows we've taken on enough in the past 8 months.
So if the president, again, means what he says in regard to having an open door and being willing to sit down with physicians, with members, with Republicans, then we've got a lot of good ideas, Mr. President, and we've been writing to you, we've been calling you. We haven't seen that open door yet, but hope springs eternal.
America, we recognize what you're asking for. We recognize what you need. Transparency, choice, and the things to make sure the quality of health care is what stands out most.